Greetings all. This presentation was prepared as part of the HAP823 course on Comparative Effectiveness taught by Dr. Alemi and Professor Woodaman at George Mason University, Department of Health Administration and Policy. My name is Megan Krogmeyer and I will be presenting question 2 from week 5 on benchmarking. Data balancing allows analysts to evaluate the performance of clinicians to their peer groups as if they treated the same patients. We are using stratified covariate balancing to benchmark clinicians because it will not require a statistical estimation of weights used in data balancing. Question 2 reads, the following data report patients with 10 diagnostic-related groups and 3 HCC or hierarchical condition category indices cared for by a clinician and his peer group. Use SQL to determine if the clinician is more efficient than his peer group. First, download and import the data into SQL. The data used in this analysis consists of the following fields. Comorbidities are in columns named DRG and HCC. The DRG field contains many different values. The HCC field contains values for low, medium, and high severity. The column doctor indicates whether the patient was cared for by the clinician or peer group. Outcomes of care are in column LOS. Now we need to calculate the pattern of care for clinicians and peer groups. Doing the clinician's calculation first, we declare an attribute labeled total as float and use the count of patients where the doctor is clinician. We then select DRG, HCC, LOS, the count of patients, and calculate the probability. The pattern of care for the peer group is also needed. Using the same code, we can calculate the pattern of care, but using where the doctor equals peer instead. Next, we match the clinician and peer group on strata using the data from the clinician temp table and the peer temp table. We can use a full join to match the tables on DRG and HCC. The following code was used to calculate the overlap between peer and clinician cases without synthetic cases using the match table. The percent of overlap calculated is 81.48%. We want to increase the overlap by using the synthetic cases. To do this, we will calculate the peer group's performance if it had the clinician's patients. In a new temporary table, we select NUM-A, HCC-A, DRG-A, PROB-A, and LOS-A, and then switch the probabilities of the peer group and the clinicians. To use the synthetic cases, we use the average length of stay for the peer group by multiplying the average for marginal times average for the complement marginal and dividing by the entire set's average. With synthetic cases calculated and used, the overlap is now 100%. We have successfully increased the overlap. The original question was to use SQL to determine if the clinician is more efficient than his peer group. Using the calculated length of stays and probabilities, we can determine the expected length of stay for the clinician and peer group as 2.963 and 3.048 respectively. In order to determine how much more efficient the clinician is, we take the expected length of stay for the peer group minus the expected length of stay for the clinician times 100 and divide by the expected length of stay for the peer group. The clinician is 2.78% more efficient than the peer group. Thank you for watching this presentation.